In Quebec, vaccinations continued right through the holiday. Thousands got the jab over Christmas. By contrast, Ontario stopped vaccinations altogether for Christmas Day and Boxing Day. Today, just 5 hospital clinics opened. Tomorrow, 5 more. The pause was necessary, a spokesperson says, to ensure there was no impact on staffing levels at long-term care homes and hospitals. But critics say every day counts.
I don't think that this virus takes weekends or holidays off. And I know how dedicated the healthcare workers are in this province, that they would be there to vaccinate at all hours. So let's make it happen.
Alberta is vaccinating every day except Christmas and New Year's Day. Oxford University tracked global data and found Canada's vaccination rate falls short of others. By Christmas Eve in Canada, just 0.12 people per 100 had received a vaccine. Russia, the US, and the UK far outpaced that. And Israel and Bahrain are global leaders, having vaccinated more than 3 people in every 100. Today, 27 nations in the European Union joined the race to vaccinate. A 20-year-old German pilot flew his plane in the shape of a syringe to celebrate.
The vaccines are rolling out now, and maybe an inspiration for people to think about it.
This 101-year-old in Berlin didn't have to think long. She joined people from Portugal to Poland, getting first jabs aimed at long-term care home residents and their healthcare workers. Greece's prime minister declared the procedure painless. The EU has set an ambitious goal of vaccinating 450 million people. Carolyn Dunn, CBC News, Calgary.
The head of British drug company AstraZeneca said today its vaccine will be effective against the new UK variant. The UK is expected to approve the vaccine sometime this week. Partial testing had indicated AstraZeneca's treatment is less effective than the Pfizer vaccine, but today the British drug maker said it has found a, quote, winning formula that matches its rivals. Canada's far north is set to get its first vaccine doses on Monday, days after they arrived in Canada. Territories are set to receive the Moderna vaccine, which doesn't require the same deep freeze as the Pfizer vaccine, the one first approved here in Canada. Territorial leaders say vaccinations will roll out in early January. Dr. Hoda joins us again. Doctor, we know that some clinics in Ontario are pausing vaccinations for the holidays. Is that a concern?
Well, I think we all feel just the urgency of trying to get vaccine out, especially with what we're seeing with numbers and with the new variant in the UK that's come out that seems to be transmitting efficiently. But whether a few days pause is actually going to make a huge difference, I'm not really sure. There are a lot of other factors to take into consideration, including just that cadence of when we receive vaccine and trying to match that with the clinics. Also, over the holidays, if people don't show up for their there's always that risk of wastage. And so you have to balance all these things together in order to have the best kind of strategy for vaccination over this period.
Let's talk about the 2-dose requirement for both the Pfizer and Moderna vaccines, Doctor. Some provinces like BC and New Brunswick, for example, they plan to vaccinate as many people as they can without holding back second doses. Over in Ontario, they're saving part of their initial vaccine shipments for the second dose. Which approach makes the most sense from your perspective?
Well, it seems to me that it would make sense to try and get as much vaccine out to people as possible, even if it's that first dose and trying to get a wide coverage. Because from what we've seen from the clinical trials, about 50% of people are protected first dose, and then that goes up to about 95% after having received the second dose. So even at the 50% on a population level, that would actually have potentially a good impact. I'm hoping this will be reevaluated over time as the supply of vaccine becomes more stable and there's less of people having interchanged the types of vaccines that they're getting because of supply issues.
Okay, thank you, Dr. Hoda. Dr. Susie Hoda is an infectious disease specialist with us from Toronto.